Innovative Healthcare Management LLC is listed as the owner of Colonial Heights Rehab and Nursing Center, and records show that the same company also operates 5 other facilities in Virginia, including some that have been at the center of previous CBS 6 investigations. Overall, the chain has a CMS rating of 1.8 out of 5 stars, which shows, according to the federal government, that this company's facilities have not performed well during inspections. They also have much lower staffing levels than the national average, with higher percentages of turnover. Out of 603 nursing home chains in the country, Innovative Healthcare Management's rating ranks at 516, so that's the bottom 15%. When I asked the company for a response to these CMS ratings, a spokesperson said, "We are focused as always on the care of our residents. Their well-being remains first and foremost." Now, the same company also owns Glen Burnie and Westport nursing homes in Henrico. Both are 1-star facilities.
Absolutely pitiful, disgusting, deplorable. Any words you can think of that's horrendous is the word for it.
CBS 6 recently reported on Westport. Heather Tyler's husband was there, and she claims he was left to sit in his urine for hours, his room was dirty, and that he suffered unexplained injuries.
I was really so angry, so incredibly angry. I just cried. Cried.
Then there was Steve Lambert, who alleged that he found his brother, who cannot move himself, at Westport half-dressed, in a prone position, and laying in a bed covered in someone else's dead skin.
No one should have to live and be treated and cared for under those conditions.
Tyler and Lambert submitted complaints to the backlogged Virginia Department of Health, and it took them 8 months to begin investigating. VDH eventually substantiated their complaints and found that Westport staff failed to give a patient their HIV medication for 3 weeks, yet the staff documented that they administered it anyway.
You've done multiple stories on this, and it really is a significant concern. So thank you for staying on the case.
Amid these concerns, Delegate Rodney Willett plans to support legislation that he says will help VDH provide more effective oversight of nursing homes. As CBS 6 uncovered in a previous investigation, the understaffed agency has the 3rd worst rate in the country for overdue inspections, and it has limited state enforcement powers to penalize poor performers. For example, VDH says it cannot fine facilities without petitioning in court or require training for staff.
It's not acceptable that Virginia lags in this area, and the department's ready to step up. I think they're looking for these additional resources and additional options, additional flexibilities in terms of how they enforce those requirements.
Willett also supports raising licensing fees so that the state can hire more health investigators. Last year, he introduced a bill that would have increased nursing home ownership disclosures, but that did not pass.
I do think that regardless of who's operating the facility, we have our standards, and we need to enforce those standards.
The Virginia Healthcare Association, which lobbies on behalf of the nursing home industry, says it does support increasing licensing fees. However, it would not say whether it supports enhancing the enforcement options for VDH. They say that facilities are already subject to significant sanctions at the federal level. I'm Tyler Lane for CBS 6 News.